All right. So welcome. Happy Friday afternoon. Thank you so much for being here. I'm Trevor Hausauer, family nurse practitioner here at Valley Vital Medicine, where we focus on functional medicine solutions to help you optimize your health and help your body to heal. One of the things that has been very prevalent as of late is viral illness. There has been a ton of illness going around, whether it is fevers and chills, whether it's nausea, vomiting, COVID, influenza. All of those things have been prevalent as of late, and we've had many people who have been calling the office and have been requesting or asking questions about, okay, what should I do? How should I go about taking care of myself? How should I go about taking care of my family? And so the goal today is to give you an idea of just where to start. Um, what we're going to talk about today is not all inclusive. We're not going to talk about every immune nutrient or tea or product that are out there. We don't have time for that. And frankly, I don't have time to vet every single product that's out there. There's a ton of good companies, a ton of good products, and there's also some not so good companies and not so good products out there. So encourage you to really do your research, do your due diligence. One of the things that I've done is really vetted a few companies. And so we're going to talk about those today, just the things that I recommend that people use, and frankly, just the things that I see people get really good results with. So we're going to talk about primarily based on my experience, what we've seen work here in our practice at Valley Vital Medicine. All right, so this webinar is for educational, informational purposes only and is not intended as medical advice today. So I'm not doing a medical appointment with any of you who are attending this webinar or watching a recording. The content shared is not a substitute for professional medical care. Always seek advice of a qualified healthcare provider with any questions you might have regarding a medical condition or treatment options. Valley Vital Medicine and myself do not diagnose, treat, or prescribe for any health condition through this webinar. Any protocols, supplements, or treatments discussed should be considered in consultation with your healthcare provider to determine what is appropriate for your individual needs. Participation in this webinar does not establish a patient-provider relationship. By attending, you acknowledge and agree that you are responsible for your own healthcare decisions. Valley Vital Medicine is presenters, myself, are not liable for any direct or indirect consequences resulting from the use of the information provided. Just like to make sure we're all on the same page with that. Okay, so first, let's talk a little bit about what is a virus, how it affects the body, talk a little bit about common viral illnesses. So in functional medicine, a virus is viewed as a microscopic infectious agent that requires a host cell to replicate and survive. So unlike bacteria, viruses are not actually living organisms. So when people talk about killing a virus, you can't actually kill a virus. But they are genetic material, DNA or RNA that are encased in a protein coat. They hijack the host or yourself cellular machinery so that they can reproduce, often triggering an immune response that leads to symptoms of illness. So from a functional medicine perspective, the impact of a virus depends on the host's immune resilience, nutrient status, microbiome status. So in other words, what that means is the mix of bacteria that are in your gut, risk for infection, parasite imbalances. Also, your overall metabolic health is a significant factor. Other factors, chronic inflammation, oxidative stress, toxin exposures, underlying imbalances, again, gut imbalances can influence viral susceptibility, severity, and recovery. So we want to make sure that we have you, all of us, in as optimal health as possible, so that way, as we are exposed to viruses, and bacteria as we go through life, that our body is able to respond in a healthy way and we're not sick for weeks or months on end. Okay, so let's talk just real quick about how conventional medicine might approach a viral illness versus how generally, excuse me, how generally I think about things, or another functional medicine provider might think about things. So rather than focusing only on antiviral drugs, okay, so if you go to a conventional medicine provider, they might say, hey, drink a little bit of orange juice, drink some tea, but here's your potential antiviral drugs, such as Tamiflu or a different antiviral drug, but then also they might offer, take some Tylenol, ibuprofen, those types of things. However, functional medicine aims to strengthen the body's natural defenses through immune supportive nutrition, targeted supplementation, lifestyle interventions, and addressing root causes of immune dysfunction to enhance your viral resistance and recovery. So on this topic, I would like to have a disclaimer here and just kind of talk a little bit about Tylenol and ibuprofen, because Tylenol and ibuprofen are probably two of the most common things for people to utilize when they're not feeling well, right? However, I think that it's important for us not to utilize these things or turn to them so quickly when we start getting sick for a couple different reasons, especially when we're considering from a functional medicine perspective, we want to optimize the immune system function. So here's what. So the body is fever is the body's way of fighting infection by creating an environment that is less favorable for pathogens. So in other words, the higher the temperature it is inside the body, the harder it is for the viruses to replicate and divide and continue to take ownership of your cells. Same thing with bacteria. As you have bacterial infections, that's why our body naturally creates fever. So we want to allow our body, within reason, to continue to have a fever. So Tylenol and ibuprofen suppress fever, which can interfere with the immune system's natural ability to fight off virus or bacteria. So in other words, if you don't feel well, you have a fever, that's actually not a bad thing, okay? So research suggests that reducing fever can prolong or make worse your illness in duration in some cases. So in other words, you might be sick longer if you use ibuprofen and Tylenol. You may not be quite as miserable in this exact moment, but your illness may last longer. So ibuprofen, or NSAIDs, may blunt the immune response, potentially making infections worse or last longer. Okay, that's what I'm saying. So some studies actually suggest that NSAIDs, or ibuprofen, can actually increase viral replication or delay the body's ability to clear infection. Tylenol, or acetaminophen, is processed by the liver and can be toxic in high doses when taken frequently. When the body is already burdened with an infection, liver function is critical for helping to detoxify inflammatory byproducts. Ibuprofen is processed by the kidneys, which can be strained during illness, especially if there's dehydration or any pre-existing kidney concerns. Studies have linked NSAIDs to higher rates of complications in respiratory infections, including influenza and COVID-19. Some research suggests that ibuprofen could worsen lung inflammation in viral illnesses, and Tylenol can deplete glutathione, which is a key antioxidant necessary for immune function and detoxification. Okay. So NSAIDs like ibuprofen can also increase your gut permeability or cause leaky gut, which can lead to increased inflammation and a weakened immune system. So our goal in functional medicine is to optimize gut health as a foundation of immunity, and taking NSAIDs or ibuprofen can really disrupt that gut microbiome. So this is our team here at Valley Vital Medicine, myself here in the middle. We are missing a couple of individuals on this picture. Vaughn, who works our front desk, and then also Emily, who is our nurse practitioner that joined our team last fall. This picture was taken last summer. This team is absolutely amazing. I wouldn't be here without them. So they love seeing you as well. So any day that you come in, you may see one, may see all of us. But just know that we have an entire team of people here who are dedicated to you and your health. So it's a fun team to work with. Greatly appreciate those ladies. So let's talk about foundational immune support. I can't go through and talk about some of the supplements and talk about some of the IVs and some of the power tools that we have without talking about the foundational immune support things that we all need to be doing. Lifestyle factors are incredibly important. You have to eat well. If any of us are eating a ton of processed foods, if we are eating a lot of sugar, if we are not getting enough vegetables, fruits, we are not going to have an optimally functioning immune system. So nutrition is incredibly important. Sleep. How many of us get our optimal 7 to 9 hours of sleep per night? If you look at research, if you are getting less than 7 hours of sleep per night, you are not going to be as healthy as if you do. In fact, one night of short sleep can actually set you back metabolically as though you were pre-diabetic. So it is very, very, very important that you are getting your 7 to 9 hours of sleep per night. Stress management. If we are living our life in a constantly stressed state, that is also going to dramatically reduce the function of your immune system. We have to be able to manage our stress. One of the best ways of managing your stress is through movement and sunlight. Now, part of the reason that I think that we all get as sick as we do during this time of the year in North Dakota or in the upper Midwest is the fact that we just don't get a whole lot of sunlight this time of year. So going on vacation, if you have the ability to do that several times during the winter for a few days or a week and go somewhere that's sunny or go sit on a beach, is a really, really good, healthy thing to do. If we can't do that, we need to optimize and make sure that your vitamin D levels are at their absolute best. So let's talk about just some basic key nutrients for immune system function. And these are things that I think that we all need to have available, have in our arsenal, and just some, like I say, some real basics. Ganoderma. Ganoderma is one of the most basic things that I think all of us should take advantage of. Ganoderma is a medicinal mushroom. It contains beta-glucans and triterpenes. What that means is they help to modulate and improve the immune system. There are thousands of studies on Ganoderma and the benefits of Ganoderma in improving the immune system function, even fighting things like herpes and other infections. Ganoderma also helps to reduce inflammation, enhances resilience against infections. If I start getting sick, and if my staff start getting sick, if my wife starts getting sick, one of the first things that we go to is starting to take Ganoderma, and taking Ganoderma at a hourly pace, to be honest with you. Vitamin D is incredibly important in that it supports immune cell function, reduces inflammation, and plays a really key role in defending against respiratory infections. Vitamin C. Many of us are truly deficient in vitamin C. I am going to do a webinar on vitamin C and the importance of vitamin C in the next month or two. Okay, I'm actually in the midst right now of taking a certification class on high doses of vitamin C. Vitamin C So I should clarify, Ganoderma has no known toxic dose. You can take it every hour of your life in huge amounts, at whatever frequency you want. There is no known toxic dose. Same thing with vitamin C, actually. So vitamin C, you can take every hour in really, really large amounts. Now, what might happen is that you might get some loose stools. What that means is you've actually saturated the vitamin C receptors in your digestive tract, but that does not mean that you have reached a toxic dose of vitamin C, because we can give really, really large doses of vitamin C in the bloodstream via an IV, but and there is no known toxic dose in doing that. Zinc next is essential for immune cell development, helps to reduce the severity and duration of infections, and has antiviral properties. Probiotics are important in that they help to support the gut microbiome balance, enhance mucosal immunity, and improve the body's ability to fight off bugs or viruses. Omega-3s, so these are your fish oils, help to reduce inflammation, support immune cell signaling, and help to regulate immune responses to prevent excessive inflammation. So making sure that your omega-3 levels are at an appropriate level is also very important, and we can actually measure that. So prevention through functional medicine protocols. Okay. So this is where I come in, and I recommend very strongly that everybody gets a lab panel at least once per year. And this should be a really comprehensive lab panel. So what that means is in our lab here, or in our clinic at Valley Vital Medicine, we have kind of our standard lab profile that we do with people. And we do this as a part of what we call our wellness experience. So what's included? Your blood counts. We do a metabolic profile. So that's blood sugars, liver, kidney function, electrolytes. We look at magnesium and phosphorus. We do a GGT, which is a special liver enzyme that we take a look at. Vitamin D, B12, folate. We do an A1C, which is a 3-month average of blood sugars. Do a lipid panel. We do a full iron panel. We do a full thyroid panel, which is 7 different thyroid markers on everyone. We also do homocysteine and CRP, which look at inflammation markers. In addition to that, I highly recommend that you get your sex hormones taken a look at. So for guys, we should be looking at your testosterone. And for women, looking at estrogen, progesterone, testosterone, and all of that is included in kind of those base panels, in addition to looking at omega-3 levels. So I highly recommend that if you have not had this done, that you do have this done, so that way you can make an educated decision on what it is that you're deficient in, so that way you can make sure that you are setting yourself up for success in helping to prevent your likelihood of getting sick. Because if you don't have data to make decisions from, how do you know where you are? And how do you know what's right for you? So what I really, really love about what we do is that what we have to offer has a really huge potential for helping you and making you better with a really, really low risk of harm. So let's not forget about taking that extra step of prevention. So if you want to use some of those power tools to help to take your body and your health and your immune system to that next level, I recommend that you consider utilizing ozone therapy and IV therapy preventively to help keep those nutrient levels up. And you can do that as frequently as once to twice a week to once a month to help to maintain your levels, depending on what your nutritional status and health status overall is. There have been many times that I've had clients that have told me that have been in the midst of either a little bit more of an intense IV plan or more of an intense supplement protocol when we're going through and doing detoxifications and doing that kind of stuff, that have told me that their entire family, their friends, the people around them have all gotten sick. However, they've been able to maintain their health throughout. So it does make a difference. Now, it's really important that you recognize early symptoms and that you take immediate action. So I actually made this mistake here about 3 weeks ago. I started getting the chills on a Monday, and I didn't really recognize what was happening. And so I kind of let it go on. Just thought, it was cold outside, so I thought I just had a chill from that day. And then before I knew it, that night, the chills were still going on. And then the next day, the chills were still going on. And thought that I could just start by doing some simple oral, kind of minimal supplementation at that point. And frankly, I was a little bit too late. And so it took me a couple days to get a hold or to be able to get ahead of the symptoms that I had. So it's really, really important that we take this seriously right up front. And I highly recommend, so you need to have a virus emergency supply at home. You have to have the things that you need proactively at home for when you're likely to get sick. Do not wait until it's too late. Don't wait until it's a Friday afternoon or a Saturday when you actually come down with symptoms and now none of the places are open where you need to go to be able to get stuff, or you want to order something and you hope to have it the next day, and now it's a Friday and you're not going to get something till Tuesday. So let's talk a little bit about some of those things that I think that we all should have at home. Okay. So I've got kind of my stash of stuff here next to me. So I'm going to be kind of grabbing some things and showing them to you. So first of all, this is the Ganoderma spores. Okay. So what Ganoderma spores are, it is the most nutritionally dense part of Ganoderma. And this is from a company called Organo. And the reason that I utilize this company is because the next closest company, as far as the nutritional bioavailability, is only about 15%. Okay. Ganoderma, Organo has a patented process for being able to get the nutrition out of the Ganoderma spores, which allows for a 90% bioavailability of the nutrition in the Ganoderma. This is a go-to for myself and for many of my staff and also some of our clients now. So if you start getting sick, you can start taking a couple of these, or this is what I do, I should say. I start taking a couple of these every hour just to help to get that into the body, start fighting against that sickness. So Pure C. So Pure C, you can see a picture of it there on your screen. I have right here next to me some packets. So vitamin C is not super simple. In other words, vitamin C is not vitamin C, is not vitamin C, is not vitamin C. So in other words, what you go to the store and you pick up from Emergency or one of these other brands, the quality of what is out there is not all the same. I would highly encourage you to look for a product that is sodium ascorbate. Most vitamin C's that you will find out there are ascorbic acid. Ascorbic acid is not the same as sodium ascorbate. One of the things that's really, really concerning to me and is very often present in kiddos supplements is a chewable vitamin C. And that chewable vitamin C is ascorbic acid. Well, ascorbic acid has a really low pH. And the problem with that is that it actually will degrade and dissolve the teeth, your dentition. Also, sodium ascorbate, because of the low pH of it, your body has to work hard to be able to neutralize that pH so that it can actually utilize the vitamin C. So utilizing something like Pure C's SNC, which is a really, really pure version of sodium ascorbate, is a neutral or a balanced form of vitamin C. You can actually use this as toothpaste because it is a neutral pH. You can take and you can put it inside a nebulizer. You can take and you can snort it into your sinuses. Yes, I am talking about snorting a white powder into your sinuses. So this is a vitamin C option, though. I'm not talking about other things. So if you start getting some congestion, you have a infection in your sinuses, you can actually snort or inhale the Pure C powder there. And you can use it, of course, orally. Utilizing, so my protocol for myself when I start getting sick is to start taking a dose of vitamin C every hour until you get loose stools. Now, ascorbic acid, you may achieve getting loose stools fairly quickly, which is not necessarily a good thing. However, the sodium ascorbate, you can actually take a lot more doses of vitamin C before you get to that before you get those loose stools. Now, as I said, there is no such thing as a known toxic dose of vitamin C. Vitamin C, it is very easy to underdose, but impossible to overdose. So keep that in mind, okay? Couple of my other go-tos, these are ones that are definitely in my medicine cabinet at home. So Nutridyne's Immune Resilience. So what's in here is quercetin, ginseng, turmeric, elderberry, andrographis, hatenuna, EGCG, resveratrol, and luteolin. This is a really great mix of nutrients that helps to support the immune system. And I found that this makes a really great combination with immune support. So immune support has some vitamin D in it, some vitamin C, zinc, selenium, but it also has a mixed mushroom blend. So there is some more reishi in here, but there's also shiitake mushroom, fuling mushroom, turkey tail, Coriolus, oyster mushroom, maitake mushroom, cordyceps. So this is a really great mixture of nutrition along with the other things that we're talking about that really, again, I have found to make a true difference. Now, also on here, I have a nebulizer. If you don't have a nebulizer in your home, it's my personal opinion that I think we all should have a nebulizer in our home because there's so many different things that you can do with a nebulizer. But it's really, really crucial, especially if you get shortness of breath, if you get cough, to be able to get nutrients or get things into the lungs. So I'm going to show you here real quick. So this is a nebulizer. Okay, so it just plugs in. And then there's a plastic cord that just plugs into the top. And, you know, we do actually have nebulizers here at the office. If you don't have one and you need one, you can call us and you can purchase one here. And then there is a hydrogen peroxide nebulizing solution. This, again, is a go-to in my home. I have my kids do this minimum 4 times a day is the goal. If they are coming down with a respiratory illness, runny nose, cough, those types of things. As a part of the recording that I send out from this, there's a website that talks through how to create or how to do a nebulizing hydrogen peroxide solution. However, what I recommend that you do, let me open this so I can just show you. A lot of people get confused about nebulizers and how they work. So this is how the mask comes. Okay. So inside of here is the medication cup. So the medication cup, the top twists off. And so you can see here it's open. And then what I do is I take a little syringe like this, and I make this, or I should say our nurses make this hydrogen peroxide solution in a bag of saline. So we mix some hydrogen peroxide in here, some magnesium. So there's a little stopper on here. So I actually just poke this in there. And I pull up about 3 cc's or 3 milliliters of the solution. I put that into this medication cup. So let me put the cover back on this here. And then what I do is I take about an eighth of a teaspoon. You could do a little bit less if you want. Sometimes it can be it could minimally irritate your sinuses. But I take about an eighth of a teaspoon of the Pure C powder, the SNC powder. Don't do this with ascorbic acid. Trust me, not a good idea. And I put that vitamin C, that sodium ascorbate, into this solution. Put the cover back on and close it. And then I just swirl it until it dissolves. And then once it's dissolved, put it on the mask. So it looks like so. And then hook it up to the end of the other end of the plastic tubing that's hooked up to the nebulizer, and then turn it on. And what's going to happen is it's going to push a bunch of air into the solution, and it's going to nebulize, or it's going to turn that solution into a gas so that you can inhale it. Okay. The hydrogen peroxide solution, what that does is it actually has very strong antiviral, antibacterial properties. And it also works really well as a carrier for the vitamin C, this Pure C, the sodium ascorbate. And so that way you can actually inhale and get that vitamin C, the sodium ascorbate, into your sinuses, into your lungs, and has really great antiviral properties. Okay. So that I think is really, really important. Another one to consider that I think is really important is melatonin. Melatonin is another substance that I think that there is a lot of confusion about. Many people think that if they take melatonin, they're going to maybe overdose on it. They maybe think that they are going to turn off their body's own ability to make melatonin. And I will tell you that those things are completely false. There, in addition to the other things that I talked about, like the Ganoderma spores, vitamin C, there is no known toxic dose of melatonin. Now, sometimes it may cause some drowsiness or grogginess in the morning. That is true. However, melatonin in this case actually has very strong antiviral, antibacterial properties. And so in my opinion, for myself, and I think it's a good idea to consider utilizing melatonin as a part of an antiviral protocol because it has those strong antiviral properties, and also may help you sleep a little bit extra well when you're not feeling very well. So those are kind of the basics there. Now I've got a couple things here that I'll show you as far as just the things that my kiddos use at home to help to maintain their health. So as you may know, as you've seen with some of the other nutrients and stuff here, I'm a pretty big fan of Nutridyne. I think they have really good quality stuff. They have a kids chewable multi, which is a orange cream flavor. My kids like that. They think it's pretty good. They have a children's chewable immunity. Okay, so this is a baker's yeast, beta glucan. This is more of a lemon flavor. My kids don't complain about taking this at all. They actually really, really like it. And then we also have a chewable probiotic. Okay, So a good way of getting some of those extra nutrients, some of that extra nutrition into our kiddos who oftentimes can be quite picky, not maybe they're not eating the healthiest, they're going to school and they're getting school lunches and all that kind of stuff. Not good stuff, right? I'm not impressed with the nutritional quantity or quality of what happens in a lot of those situations. Okay. All right. So additional support for symptom relief. So let's talk about what are some of the other things that you can think about adding in to your routine, help you to feel better a little bit quicker. So we here at Valley Vital Medicine, and I can't take credit for this, my nurses and staff turned me on to Rocasa. And frankly, it's just been a huge hit. Many of our clients just absolutely love it. And some people drive from a long ways just to come to get some of this stuff. But what we love about them is they're organic. They're really, really clean. We know that we can trust them because, a lot of the stuff that's out there that you might be buying from a big box store has a lot of extra ingredients in it, has some extra preservatives in it, and things that are just frankly not good for us. So some of the things that I think are good potential additions are they have an elderberry. So this elderberry, honestly, this last time that I was sick, I cracked one of these open and I drank half of it the first day and another half the second day, and it tastes amazing, but a really great way of getting immune support in. So what's in here? There's a little bit of vitamin C in here, the organic elderberries, but some honey, raw lemon juice, organic ginger root powder, organic Ceylon cinnamon powder, and then clove as well. So really, really good stuff. Tastes really good. Now my kids, they prefer more the antioxidant. So in here, this is more of an aronia berry. So that also is good for helping with inflammation or oxidative stress. There's organic cranberries, organic blueberries. But also what I find really interesting about this product and a reason that I think that it works well in viral illness is there's actually liposomal glutathione in here. So that glutathione, that what your body gets depleted of if you're utilizing Tylenol, ibuprofen, there's glutathione in here, which can help with that oxidative stress and help your body to heal. So like that a lot. Now, a lot of times we get these swollen lymph nodes and it's hard to get the fluid that's in that lymph to move. They have a lymph lotion. This stuff works absolutely amazingly well. We have a hard time keeping it on the shelf. Works great. There is a healthy version of cough syrup. So in here is apple cider vinegar, raw honey, ginger root, some essential oils, and those are lemon, orange, frankincense, peppermint, and lavender. So a healthy version of a cough syrup. You don't have to feel bad about your kids using this stuff. Now, honestly, one of the cheapest, my favorite things is their sinus decongestant spray. I think this stuff works absolutely amazing. I use it to help keep myself help keep myself healthy, because there is some colloidal silver in here. So I use this, and I usually will do a spray in my nose once a day, if not twice a day, just to help to kill off any potential or break down any potential viruses or bacteria that have gotten into my sinuses, into my nose through the day. And then there's some olive leaf extract. There's some essential oils, peppermint, eucalyptus, or oregano. So I like this a lot. There is so they've got all kinds of stuff. Immune support salve. So it's a topical essential oil salve that can help support the immune system. Sinus and headache salve, that's very similar. There is a all natural relief. Okay, so this is a healthy version of Tylenol. So what's in here? So curcumin, liposomal willow bark, liposomal ginger, black pepper, and then there is copaiba essential oils in here. And so this can help with just kind of fevers, not feeling very good. And there's a kid's version that's honey-free as well. There's a throat spray for when you're struggling with that sore throat. There is a earache oil. You can utilize this in the ears, utilize it topically around the ears. It actually works really, really well for helping with earaches. And then there are some essential oil blends for a lung support and then an immune system support. So a couple weeks ago, my son had a cough, and we took some of this lung support home, kind of put that all over his lungs. He was doing the nebulizer, and he was turned around in a really pretty short period of time, and it seems to really make a great difference. Integrative Therapeutics V-Clear is another great product. I don't have it here with me right now, but that is another great one that can help to really reduce just kind of the not feeling well part of being sick. Okay. Now, a couple other things that I'm going to mention that you may want to consider. Okay. So Vired Chem Binder. I think that we are exposed to tons and tons of toxins on a regular basis. Being on a binder, if not daily, close to daily, I think is really, really important. I love Cellcore and their binders because their binders are selective for what they're designed for. So Vired Chem Binder in this case stands for viruses, radiation, and chemical. Okay. So this can help to bind up and help you to eliminate some of those viral proteins. So help get those out, and binds them up and pulls them out in your stool. One last thing that I'll mention is methylene blue. Okay. Not sure if you know much about methylene blue. Methylene blue was one of the original pharmaceuticals that was ever developed. Has some really great, amazing antiviral, antibacterial effects, but also helps to promote mitochondrial function. Now, you can utilize this in combination with red light therapy to activate it and help to oxygenate your tissues. So this is something to consider. A caveat with this, methylene blue acts as a weak MAOI. So MAOIs have been used in the past for anxiety and depression and some of those kinds of things. So if you are on SSRIs or anxiety and depression medications, encourage you to, methylene blue is probably not the right fit for you because there can be some cross interactions with that in causing what they call serotonin syndrome. So we got to be really, really careful. If you're not on those things, and you're a patient here, please feel free to ask me if this would be right for you, or talk to your medical provider, or do some more research online for yourself. But methylene blue has a lot of really, really great benefits in just helping your brain function, and again, helping to keep you or get you healthy. Okay. So those are some of the what I would consider just great everyday tools, things that can help you in the cases where you start to get sick, or you've been sick for a little bit and you really need to hit something orally. That's your best option. These products are amazing, and frankly, they work. So while those are all absolutely amazing and they work, if you're like me, a lot of times you're looking for something with a little or a lot more punch. Okay. So my preference really is to be proactive and preventative. So IV therapy, I think, is one of those ways where we can achieve a level of response where you can't do it otherwise. Okay. So IV therapy. So this is a picture of me here from last summer where I was getting what we call our fountain of youth. Okay. So what's in there is a nice mix of B vitamins, some calcium, magnesium, 15 grams of vitamin C, and then we follow with a couple of grams of glutathione. It's a great way of staying healthy. And you can do one, like I said before, if we do these things on a regular basis, we can optimize our body so that we don't get sick. Now, these things are safe enough that you can do them up to a couple times a week without worrying about having any level of toxicity or harming anything, which is really, really amazing. And I love that. To maintain the benefits, I really do recommend once a month of an IV nutrient and an ozone therapy. So what's ozone? Oxygen, of course, is O2. Ozone's O3. So it has an extra oxygen molecule on it. Okay. So what we can do is we can utilize ozone all over the body. We can do injections with it. We can treat the blood with it. Once we put that extra oxygen molecule in the body, what it does is it dissociates from the rest of the oxygen really, really quickly, and has a beneficial effect in that it's antiviral, it's antibacterial, and it super oxygenates the tissues and improves blood flow. Okay. Love ozone. I love IV nutrients. I think they do a really great job of keeping us healthy. Something else that we have in the clinic that I would encourage you to consider, or if you have a sauna at home, if you don't have a sauna at home, I would encourage you to get one. Saunas are really, really, really effective. Doing an optimal frequency of doing a sauna is about 30 minutes, 5 days a week, and can really reduce your toxic burden. And it can dramatically improve your metabolism. It can also improve your blood flow and reduce your risk of cardiovascular events significantly. Now, in the office, we have a super sauna called a HOCATT, which stands for hyperthermic ozone and carbonic acid transdermal technology. Okay, so this is a state-of-the-art wellness system that combines multiple therapies into one session. So it utilizes carbonic acid to improve blood flow, uses ozone therapy. So the entire capsule that you're sitting in infuses with ozone, uses far infrared heat, PEMF, oxygen, essential oils, and it promotes detoxification through sweating and through exposure to ozone therapy. So let's see here. So additional benefits, it's immune boosting, improves circulation, decreases pain and inflammation, improves skin health, improves energy and metabolism, and helps with stress reduction. We have people that go in and do a HOCATT sauna fairly regularly, and they absolutely love it because they get a real bump in energy that lasts for several days. Now, in this circumstance, what we're talking about in regard to being sick, being ill, remember what I talked about as far as having a fever and how that's good for you when you're sick, because it prevents the viruses from replicating. It prevents the bacteria from taking hold. A sauna can do the same thing. It just gives you a fake fever. So one of the things that I did the last time I got sick here about 3 weeks ago is I got in the HOCATT sauna one of the first couple days that I was sick, and really did my best to sweat out as much as I could. And I do think that that was quite effective and quite helpful. All right. Now, those are primarily things that we can do to help to keep us from getting sick. But once we're actually sick, it's important to be more aggressive. So, like I said earlier, once you start getting sick, act as quick as you can. Start getting these things in that I'm talking about. But don't wait until you're a week into it and getting worse or getting sick and saying, oh, yeah, well, I'll get better in 3 days. And then before you know it, you're 7 or 10 days out and you're sick as a dog and you're having to take time off of work. Like, that is just not a good way of going about addressing this. We got to take it seriously, take advantage of the tools that we have to get ourselves feeling better. So we have different levels of aggressiveness to use and technology that we can utilize to help knock out symptoms quickly and help to get you back to a place where you're feeling well in as short of a period of time. So first things first, like I said a minute ago, utilizing the HOCATT, utilizing sauna to initiate or increase your initiate a fake fever or increase your body temperature so that way the replication of the virus stops. Now, if you are mildly ill, one of the things that I've seen to be really, really, really effective is our Fountain of Youth IV, and we could add zinc to it. Adding that extra little bit of zinc to it really seems to make a big difference. And oftentimes we'll have people come in and do an IV and they'll leave and they'll feel really great the next day and they won't need any more. Okay. Now for moderate illness, say you're a little bit more sick, this has been going on for a few more days. I highly recommend, and I found it to be very, very effective, to do a ozone therapy. Now, the picture that you're looking at there on the right side of the screen is actually my blood from my ozone therapy that I got a couple weeks ago when I was not feeling well. In the top there, you can see that's my blood that came directly out of my vein. And this is what we call our high dose ozone therapy. Okay, so you can see it's really, really dark. And when I was looking at my blood, and so I'm quite certain that I had COVID when I was sick. I didn't test. I frankly I think that it's a waste of time personally for getting tested. But the symptoms that I had were basically the same when I had COVID the first time back in 2022. When I looked at my blood as it was getting drawn out for my ozone therapy, it looked almost gray to me. I was like, no wonder I don't feel well. It looked not very good, didn't look very healthy. And what you can see at the bottom picture here is what my blood looked like after it was treated with ozone. Okay, so super bright red and vibrant and just a beautiful color. This bright red, vibrant, beautiful blood has very strong antiviral, antibacterial properties. And so then it was reinfused and given back to me through an IV. And as it's coming back to me, it actually goes through an ultraviolet light. So that little box that you can see behind that in that bottom picture has ultraviolet lights in it. And the ultraviolet lights do very much the same thing as ozone, just very synergistically, okay? Antiviral, antibacterial, helps to improve blood flow. Now, after I did this therapy, I did a 100-gram dose of IV vitamin C. I will tell you that even though I was doing all of these other things, I was still really kind of continuing to struggle, and I had chills that just wouldn't go away. So my chills started on a Monday. On a Thursday is when I came in and I did this ozone, and I did my 100-gram dose of vitamin C. And when I came back the next day, or I'm sorry, when I woke up the next day, my chills were gone. I had finally gotten over that hump, gotten to a place where I was feeling much, much, much better. Okay. So at least at that point, I was functional and feeling much better. Now, it didn't totally wipe out my symptoms for me. And so what I needed to do, and you know, frankly, I just love knowing the things that I know, because it was a couple days later, I had one of my nurses do EBU for me. Okay. because after I had been sick, even though I was feeling a little bit better, I kind of started getting over the hump. Like I had this brain fog that was still with me. My brain wasn't working well. I was short. I was irritated. And I just didn't feel good. I didn't feel good, right? And so this is our EBOO therapy. EBOO stands for extracorporeal blood ozonization and oxidation. So in the bottom picture there, you can see kind of what's happening. So out of my right arm there, the blood is coming out and it's going through the pump on the machine, and it's going into a dialysis filter. The dialysis filter there has a really large surface area on it where that blood is continuously ozonated and oxygenated. And then it comes back and it goes through an ultraviolet light and comes back to me on the other side. This is a continuous therapy for about 50 minutes. Now, in the top picture that you're looking at there is the difference in blood, in the coloration of the blood from when the blood is coming out of me until it's going back in me. You can see how much more bright red it is. The blood is flowing much easier. And I will tell you that within 30 minutes of starting EBOO, my brain fog completely went away. This was an absolute game changer for me in being able to get myself back to feeling well in a much shorter period of time. I think I would have struggled most likely for 2-3 weeks instead of 5-6 days had I not done these therapies. Okay. Now, one more thing. I want to touch real quick on COVID, because I think that COVID and long COVID are a very real thing. There is an organization called the Independent Medical Alliance, and I am going to share their protocol or their website with you here in just a few minutes, so that way you can look this up for yourself. But what I do when I'm doing a consult with somebody who has had COVID-19, or they are struggling with long COVID, is I will review their protocols every time, because frankly, their protocols are changing all the time. And they oftentimes will, or they do have things in their protocols, such as hydroxychloroquine and ivermectin. I have found that my clients have mentioned to me that when they start utilizing these things, that it does make a difference for them. So keep those things in mind for yourself, that ivermectin and hydroxychloroquine, if you are a good candidate for it, and I'm not making any recommendations as a part of this webinar, however, it is definitely something to strongly consider. And as I said, here in a moment, I will share with you their website so you can take a look at it. Okay, so you heard my story a little bit. And this was, for me, like I said, only about 3 weeks ago. And frankly, it was part of the reason why I wanted to do this webinar today, is to share some of the tools and some of the things that you can do to help to get yourself better much quicker. And also, beside the fact that we've had a lot of people calling the office and asking about it too. Now, let me share with you a couple other stories of people who have come in recently and been quite sick. Now, a young woman, she's in her 30s, and this was this last fall. She had been quite sick for several days, and had been diagnosed with walking pneumonia. And so she knew about the things that we did. In fact, we had texted back and forth a little bit. I know her personally, and she had told me how much she was struggling. I told her, it's like, you really need to get in here, and you need to do a high dose ozone therapy, and you need to do a 100-gram dose of vitamin C following it. And let me tell you, she was miserable. Like she was barely able to walk into the office. And so she came in, She did the high dose ozone therapy. She did a 100-gram dose of vitamin C. Now, I'll tell you, she didn't feel very good while she was here, while she was doing it, right? She was quite ill. She was quite sick. But I'll tell you what, she woke up the next day and her symptoms were about 90% gone. It got her over the hump and it got her feeling better so fast. And she couldn't even believe it. I will tell you that about 2 weeks ago, we had a high schooler who had been diagnosed with influenza, and she had so much muscle pain that she could barely walk across her living room at home. She came in, her mom reached out to me. I said, well, let's have her come in. Let's do a ozone IV, and let's follow it with a fountain of youth with added zinc. And I checked in with her mom the next day, and she said, it's a miracle. She had a significant reduction in her symptoms and was able to move around without pain the next day. I will also tell you, my one other personal experience with Ibu is about a year ago. I had traveled to Jamaica and had been bitten by a few mosquitoes while I was there. And I'm quite certain that I contracted some sort of virus from those mosquitoes while I was there. What it was, I don't really know. I had kind of a low-grade fever the last couple of days I was there. I was fatigued, didn't feel very well. And I got back on a Friday and supposed to be back in the clinic on Monday. And so I had one of my nurses meet me at the office to do Ibu, just because I knew personally that it was going to be probably the most effective thing that I could do in that particular situation. And I will tell you that that low-grade fever, those chills, those things were gone that next day. And so these things work. I personally use them with all of the tools that I have at my disposal and the things that I do here at the office. I love the IV vitamins. I love the ozone therapy. I love the Ibu because I see the effects and I feel it myself. It really works and it makes a huge difference. So now, ideally, hopefully, we don't get sick enough to where we actually need all of that. You can be proactive, you can be preventative, and you can keep yourself from getting that sick. So like we talked about, we have all kinds of tools that we can use. And so I hope that this has been helpful. I hope that this has been beneficial for you. I have 2 more slides, but before I get into those 2 slides, I want to know what questions you have. So if you could, down at the bottom of your screen, there should be a Q&A. Please feel free to type in there if you have any questions. I'd love to answer any questions that you have. And then I'll share the rest of the resources that I have, some websites and that kind of stuff that I think will be helpful for you. Please share with me if this has been helpful for you. You know, in the last couple weeks, we've had people calling us really pretty much every day asking about, you know, what they should do for their viruses, how to take care of themselves, how to get over their sickness quicker. So I hope this answers that question. This is recorded. I'll send out the recording to everybody, and would love to answer any questions for you if you have them. Otherwise, please feel free to reach out to the office anytime as well. So I'm not seeing any questions popping up yet, so I can still come back to any questions that you might have. But let me see here. I want to kind of get to those next resources here for you. So how to work with us here? You know, we do offer free IV consults. They are available for booking online. So if you go to our website in the upper right-hand corner, it says work with us. There's a place there where you can register for a free IV consult. If you've already been here and you are a client of ours, then you can just register for an IV just directly right in your portal. I talked earlier about a wellness experience. If you feel like that might be the right next step for you, you can also go on our website and schedule a discovery call with either myself or Emily Koska, who's our other nurse practitioner, to see if the wellness experience is the right fit for you. I will tell you, Emily is a great fit for any woman who wants to help to optimize or improve their hormones as well. That is primarily her specialty, is thyroid, gut, women's health, and hormones. Also, you can stop in anytime to the clinic. You don't have to be a patient or a client here to stop in. We offer 25% off all Nutridyne products online the first Wednesday of each month, or 20% off in store currently is what we're doing. And then protocols and links. So I've got some of that, like I say, on the next screen. And I will also email that information out for everybody once I send this out. And I expect to send out that recording probably tomorrow. Andriana has a comment here. This has been very helpful. Thank you so much. Certain form of zinc that I recommend. Yeah, so zinc, so the immune, let's see here. Actually, this doesn't have zinc in it. So the Zinc Pro from Nutridyne is a really great product. So that generally is the one that I am recommending. I've seen good results with that. And red light therapy. So I do like red light therapy a lot. I think that it is quite effective. It's quite helpful. I haven't done a super deep dive on red light therapy. But I do know that it helps to improve mitochondrial health. I know that it helps to optimize and activate methylene blue, which can have, like I say, antiviral, antibacterial effects. So utilizing it with that, I think, is helpful. Generally, my recommendation is to do about 20 minutes or so of red light therapy. And at a time, I think you can do that a couple times a day, especially when you're ill, or 20 minutes once a day can be really helpful. I did see a really interesting article recently where they utilize red light therapy for thyroid concerns. And they did red light therapy every day for, I think it was 3 months. And after 3 months, the people that had imbalanced thyroid saw their thyroid come into full rebalance without needing any additional supplements or medications. So I thought that was pretty amazing. And the effects of it lasted for, what was it, 9 months or a year or so. So that's really interesting, and I think really can speak to the power of the red light therapy. Leroy, this has been very informative. Thank you very much. So thank you. You don't have any questions, but you wanted to thank me for what we're doing and for helping people. So, all right. Well, thank you so much for that, Leroy. I'm just glad to be able to be here and to be helping people. So here are the links that I had mentioned to you. And what I'll do is I will send out all of these links as a part of the recording when I get this out to you. The website for us, as far as setting up a wellness experience or a IV consult, IMA Health, which talks a lot about ivermectin as well as hydroxychloroquine and treatment of COVID. They also have some really great cancer resources, some of those things on there too. So really like what they're doing. Reardon Clinic is responsible for the vast majority of vitamin C research that's been done in the last year, or I'm sorry, in the last 50 years. And so, and I actually went to Reardon Clinic to get trained in vitamin C therapy. So the George Kramer website there, he actually has some information on the hydrogen peroxide protocols. And if you have questions about that, you can always reach out to us. Rocasa Organics. So we carry a lot of their products here in stock. Or if you want to order online, use the code VVM20 to get 20% off your first order. There's our Nutri-Grind store, Organo Gold for ordering the Ganoderma spores, and then Full Script for the V Clear. Deb, no problem with being late. Glad you're able to be here. Yep, I'll definitely send you the recording. And then Andriana says, you're currently utilizing liposomal vitamin C, but it's made with L-ascorbic acid, 1,000 milligrams. So wondering if you should consider trying the other one you recommend instead. Yeah, actually, I should have shown this one too. I think that this is another really great version of vitamin C. This is a lipospheric vitamin C. Now, one thing to know about liposomal vitamin C, kind of like with what you have, I don't know if it's a single serve type container or if it's like a bigger screw off top. But those types of containers, oftentimes when you open them, like they start to degrade really, really quick. So if you utilize like this lipospheric vitamin C, it's in little packets. And so the benefit to that is as soon as you open up the packet and you take it, there's no time for it to degrade. Now, as you said there, it's made with L-ascorbic acid. So this one also is sodium ascorbate. Now, so the L-ascorbic acid, so if it's a liposomal C and you're drinking it and that ascorbic acid is washing over your teeth, it can degrade the enamel on your teeth. So you got to be really, really, really careful about that. So I'm not 100% saying you can never use ascorbic acid. I'm just saying we have to be really careful about what it does to our dentition in our mouth, especially if we're utilizing it regularly. Because it can cause problems that way. So I do think that sodium ascorbate is a better form of vitamin C than ascorbic acid. It's going to get better absorbed. It's going to be more effective, and frankly, it's just safer. Okay. So yeah, yours is a screw off cap and it's a liquid that you drink. So I would recommend something more like this. I think that likely the what you have, it's not going to maintain its potency very well if it's that type of a product. That's my personal opinion and based off of what I know. Any other questions for me as we wrap up here today? Thank you so much for being here. It's fun to see people come in live and answer any questions that you might have. I will take some time to get this recording uploaded and send out the links and the follow-ups and all that stuff. My goal is to have it done tomorrow. Anything else for me here? Give it like 1 more minute. All right. Thank you so much for being here, everybody. It was great seeing you. Have an amazing weekend. I appreciate you all. Thank you for being live, and I'll work on getting this information out to everybody. Have a blessed day. We'll see you.